Welcome back to Sleep Better TV. My guest today is Dr. Dawne Slabach of the Craniofacial Care Center in Columbus, Ohio. Thanks so much for joining us today, Dr. Slabach.
Thank you for having me.
Let's talk a little bit about oral appliances. Now, what causes teeth grinding?
Well, there's a couple of things that can cause teeth grinding. There's probably a small amount of the population that just neurologically are wired that way. But the two most common reasons that I see for teeth grinding are dysfunction within the jaw joint, a TMJ disorder, as well as some level of sleep disorder breathing, obstructive sleep apnea being the most severe form.
Now, we've heard a lot about bite guards. So tell us first, what are bite guards and how are they used?
Well, our training in dental school, basically we are all taught that if anybody has anything that could possibly remotely be related to a TMJ disorder, without a diagnosis, just throw in a flat, plain piece of plastic and hope that it works. That's the way we were all trained. But there are definitely some problems with that. Yes, it will protect the teeth, but there are several studies out there that show that it can actually make an airway worse. That is, if we put it into somebody who has a sleep disorder breathing problem, their breathing gets worse at night. And I believe it also can allow the jaw to slip back and irritate the blood vessels and nerves in the back of the jaw joint and make a TMJ problem even worse.
Now, what are some of the potential complications with using a flat bite guard, or what might you recommend?
I still do night appliances. I still do some form of a night guard, if you will. The particular design that I use, a couple of things, does not allow the back teeth to touch. There was a study out of Stanford several years ago that if you put something between the back teeth of somebody who clenches and grinds, they tend to clench and grind about 50% more. And the other thing that my appliance does is it doesn't allow the jaw to fall back. It actually has a little ramp on the front that holds the jaw forward, which does two things: decompresses the jaw joint where the blood vessels and nerves are. Also can potentially open up the airway in somebody who's struggling to breathe at night.
Thank you so much, Dr. Dawne.
Thank you.
My guest today has been Dr. Dawne Slabach of the Craniofacial Care Center in Columbus, Ohio, and you have been watching Sleep Better TV.